I'm like, you know, tamoxifen can be estrogenic, right? Like she knows all this stuff, like, and it can be very painful for a woman and like for those that don't know, there's estrogen blockers which bind to the estrogen receptor, and then there's aromatase inhibitors which block the conversion of androgens to estrogen. So there's kind of two classes there. They are a huge industry, $15 billion industry, like massive, projected to double like in the next few years. And so they do work in a sense, but I think there's so much better things that can work. And one of those things that could work so much better, in my opinion, is high dose progesterone. But people comment every day, what's something I can take instead of estrogen blockers? And I'm like, well, maybe one of the most obvious anti-estrogens is progesterone. Um, you could explore that, and I try to kind of hint at it, maybe something you could look into on your own because progesterone decomposes the estrogen receptor, whereas tamoxifen has all these side effects of it's really painful. If you talk to a woman on, any kind of estrogen blocker, it's so, so, so painful. And to the point where a lot of them just deny it. They're like, I'm not going to do this. But I'm like, well, why don't you use something a little bit safer, progesterone? But can't really say it out loud, especially if you're a doctor.
Someone's going to say, what are you talking about high dose? How high is high dose?
I think like 400 milligrams is considered high dose. I mean, so most menopausal women start on 100 milligrams of progesterone, which is what we start with at Reina.